Anthony Albanese, it feels like everyone now has a story of someone they know catching COVID. What's yours?
Well, my worst story is that of Katie Gallagher and her young daughter Evie, who of course caught the disease at a time where she wasn't eligible to be vaccinated. I think it's every parent's worst nightmare to be in a circumstance whereby they feel as though they can't provide assistance. Katie certainly did that. But it was a traumatic time for Evie and the whole family. And I think that right now there are so many families who can't get their children tested, can't get their children vaccinated, who'll be going through the same thing at the moment.
I suppose I meant, what about the experience now, the fact that everybody seems to be catching COVID across the community?
Well, I spoke with Meryl Swanson today, who's a Member of Parliament, of course, part of my team, the member for Paterson. She's caught COVID. Her daughter's caught COVID. Her husband couldn't get a test as of today, was driving around trying to get tested for COVID, just adding to the trauma for that family.
Well, the numbers are clearly exploding. What should the government be doing about it?
Well, the government should have prepared for this. The use of rapid antigen tests, for example, were there in September, were approved by the TGA. It came into force from the 1st of November, and now we have supply issues. We have supply issues with boosters. So people can't get boosters. They want to go get tested. They can't get tested. They're waiting in queues for hours. They need to be sent away. Then they get told, well, you can't do those tests. Go get yourself a rapid antigen test. They can't find them. And if they can find them, they can't afford them. This is a public policy failure of momentous levels.
But is it something that you could fix overnight if you were suddenly in government?
Well, you can't fix this sort of debacle overnight. But what you can do is actually plan forward. This Prime Minister likes to speak about shake and bake. Well, this Prime Minister is characterised by set and forget. He just sits back, and even when he turns up, it's almost like he's still missing in action.
The Prime Minister said yesterday the federal government wouldn't subsidise all rapid antigen tests. You seem to agree with him.
No, I think that anyone who needs a rapid antigen test shouldn't be excluded from it because of their income. Our health system is based upon the principle of Medicare, that people get the health care they need when they require it.
But
and
based on...
At the moment, they're not getting that support.
But Mr Albanese, based on Medicare, everybody should be able to get access to these tests, shouldn't they? I mean, everybody can get access to the PCR tests at hubs. Absolutely,
and I have no problem with that at all if the government was to do that. They need to make sure, though, as a priority, given where they're at, one of the things that we're trying to do is to encourage the government to make sure that no one's excluded. The circumstances whereby, for example, the Exodus Foundation had to spend $13,000 of money raised for that Bill Cruz raises to feed the homeless and to look after the vulnerable on rapid antigen tests so people could attend the Christmas Day lunch. And now they're having great difficulty getting access to a rapid antigen test to provide for these vulnerable people.
But Sharon Lewin says the test should just be free for everybody. Do you agree with that?
Well, I'd have no problem with that whatsoever. The truth is that at the moment people can't get access to supply, and if they can for so many people, it's simply unaffordable.
For much of the pandemic, you've put forward a pretty straightforward plan for how Labor would deal with COVID. That was to fix the vaccine rollout, build dedicated quarantine facilities, have an effective public information campaign and start making mRNA vaccines. Do we still need quarantine facilities, and who would you see using them?
We do. We still have Australians who were told they'd be home to Australia last Christmas who still haven't been able to get home. We still have an issue with regard to quarantine, and it's good that Anastasia Palaszczuk has stepped into the gap to help with the WellCamp facility outside of Toowoomba. The fact is that it's a tragedy that a year ago we were raising those very issues, and now, a year later, we still don't have an effective rollout of the vaccine. In this case, boosters. People are getting their appointments cancelled. We still don't have purpose-built quarantine. The public information campaign is confusing, to say the least, Anyone who can understand the Prime Minister's last press conference was incredibly confusing and contradictory. And of course, we're still not producing mRNA vaccines here, in spite of the fact that the industry minister of the time, a couple of industry ministers ago, said that by now we'd be producing it.
One of the first measures the government took when the pandemic started was to close the borders. Given what's happened with Omicron, do they still need to be closed, or would it be better to open them to help us get the skilled workers in that we need?
Well, we need to get Australians home, and in many cases that's precisely the example as well of where purpose-built quarantine could assist with that process, and also with assist with getting the skilled workers, and many of whom are needed to keep our economy and businesses going.
What's your reading of the economic impact of the morphing of the pandemic in the last month? And does the government need to consider further economic assistance to households and businesses?
What this government has never understood is that unless you get the health outcomes right, the impact on the economy will be more negative. So you need to get the health outcomes right first, and that will minimise the economic impact, will minimise the impact on jobs and economic activity.
Yes, but there is an economic impact. Should the government be doing more now?
Well, the government should be getting the health outcomes right first, but also monitoring any assistance which is required. There are still whole sectors that are just missing out, such as those in the arts community who are having events cancelled, who haven't had an income now for a couple of years. We still don't have an appropriate insurance scheme, for example, providing support for events organisers, and that's having a real impact on their viability.
Anthony Albanese, thanks for your time tonight.
Thanks very much, Laura.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.